Healthcare is ever more technology intensive, yet for all the data that are generated from numerous medical facilities across the region, across the nation, it's very hard to connect the dots to generate a true picture of what's really happening with public health and even with a particular patient. A company based right here in our region has developed a software solution that's helping to streamline costs and improve patient care. Kevin Hutchison is President and CEO of Health Monitoring Systems, and Dr. Thomas McGill is Vice President of Quality and Safety at Butler Health System, which has been pioneering one of the company's newest initiatives. And welcome. Good to see both of you.
Thanks for having us.
Yeah, Kevin, we'll start with you on just what Health Monitoring Systems is and what it is exactly you guys do.
Yeah, Health Monitoring Systems is a software service company. We've been in business since 2006. And what we do is we collect healthcare data and try and get the right information to the right people. So one of the things that we have is an MediCenter service. It collects data from 400 hospitals and distributes that to public health.
Okay, so you can paint a picture of what's happening in terms of public health, epidemics, all that kind of stuff,
Epidemics,
right?
seasonal flu, whatever's happening in the area.
But lately you're getting now to the individual patient as opposed to that macro picture, right?
Yeah, from the 400 hospital emergency departments that we work with, we kept hearing that they were struggling with new requirements for dealing with medication. So we went out and we talked to some different emergency department physicians and nurses and tried to understand what they needed. And what they were telling us, and what Dr. McGill was telling us, was that they needed to be able to get medication history from a patient automatically in real time.
Yeah, I guess I'm fascinated by this fact that it's hard for you to get the list of what a patient is actually taking when they show up at the hospital?
That's correct. There are some people that are very assiduous and keep a list updated, but the majority do not. So they may forget or not be able to recall. They may expect that their primary doctor can provide that information to us, to the doctors taking care of them in the hospital, for instance. But if they're seeing multiple doctors, their primary doctor may not even know all the medicines they're on.
Gee, and when you think about what the whole issue of medication errors and is like, and the costs of that for society, this is the gateway to what could be a whole chain reaction, I would think.
Very powerful foundation from my point of view,
yeah.
Right? Especially with drug-drug interactions.
So today, without the software, how have you been grappling with this? Because I understand Butler is a real leader in terms of trying to cope with this.
Well, so a patient comes to the emergency room or gets admitted to the hospital, and a nurse does a history, and part of that is asking them what medicines they're taking. If there are issues of lack of clarity, that nurse clarifies those by calling the doctor or a pharmacist. But if a person leaves something out entirely, then it's a blind spot for us. And that's really what we sort of discovered with this study that we didn't know that we had.
Yeah, you went about and did this very formally, and without the technology, what kind of success rate were they able to generate in terms of getting these lists of medications?
Well, when the study that we ran, it was run by Johns Hopkins PhD, who did a formal study on it. And so we had two groups, one without the technology, and the best they could do is about 70%. So if a patient came in and they got a medication list, it was about 70% accurate.
So they'd be missing 30% of the drugs they're on?
Every time I see a patient now, I'm going, what 30% of the drugs don't I know about?
Holy mackerel. Okay, so then you've got a software application. Now, where do you get this information if you're not calling up or your computer isn't calling up all the doctors?
Yeah, so our system actually links to different payer systems, so insurers and benefits managers and pharmacies and other data aggregators to try and pull that data in securely so we can have up to 1 year history of what a patient had in terms of medication.
Okay, and you can do that with all the issues around healthcare privacy. You can manage to get your hands on this kind of information and be able to apply it to an individual patient?
Yeah, actually what we have worked out with Butler is a consent procedure where the patient actually gives their consent prior to doing the lookup, so we're not just going to go out and grab people's records. And the other thing is that we can't actually see the data ourselves. So if I went back to our office, sat down in the computer system, I can't see the data. It's all encrypted, and the only people who can actually see the live data are the physicians and nurses at the hospital.
And so using this technology, how much better can you do than the 70% using the good old-fashioned telephone?
Our study showed that we could get up to 95% accuracy in about 35 seconds.
In 35 seconds? How long did it take before to track down the 70% accuracy?
Well, 70 is sort of the baseline process,
yeah.
And that's 5–10 minutes. It depends on how many medications the patient is on and what kind of memory they have.
Okay, so you're cutting from minutes to a few seconds, the process, and then the accuracy rate to 95. That has to make an enormous difference in terms of your ability to treat a patient properly.
Well, yeah, as I said, so we did the study, and then we don't have data on every patient. Not everyone has data. So, but we know of the people who do that we were missing 30% of them. So now when I see patients in the hospital and they don't have this report available on their chart, I'm wondering, well, what am I missing?
Yeah, you really probe that much harder because you know you have to be missing some things. So this is now a going product, a software service that hospitals can buy?
Yeah, it is. We launched it with the study that we did in March, and now in the beginning of July we formally launched a product and service off of it.
And I understand Butler's one of the first customers.
We're using it, right?
Yeah. Well, I guess you've seen the value it can add. If you want to find out more about it, Kevin, more about how to get it, how to get in touch with you.
You can look at our website. It's healthmonitoringsystems.com.
Healthmonitoringsystems.com. What an amazing innovation. What an incredible impact it could have, not just here, but everywhere in terms of quality health care. Kevin Hutchinson from Health Monitoring Systems, Dr. Thomas McGill from Butler Health System. Thank you both so much. We appreciate it.
Thank you.